I mean, I knew things weren't great, but I didn't realize that teenage mental health was in so much crisis, especially for young girls and teenagers who identify as lesbian, gay, bisexual, or questioning. And here's the thing, this isn't a case of parental abandonment. These teens overwhelmingly report their parents are involved with them. That's according to an alarming new report from the CDC. And if you are a parent with a teenager or a tween, you're going to probably want to know about this stuff. Now, I'm going to warn you, what I'm going to tell you is not going to be easy to hear, but I really believe this is important information to share. So make sure you're in a mental space to take it all in. And if that's not right now, then just come back to this video when you're in the right headspace. This new CDC report looked at youth risk behavior across all racial and ethnic groups. They've been studying this for the last 30 years. And while all teenagers reported some form of troubling struggles with mental health, experiences of violence, unaliving thoughts and behaviors, teenage girls far outpaced teenage boys, and the report confirmed ongoing and extreme distress among teenagers who identify as lesbian, gay, bisexual, or questioning. Nearly 70% of LGBTQ plus teens felt persistently sad or hopeless in 2021. 57% of teenage girls felt the same. That's up 21% since 2011. For teen boys, the number was 29%, which is clearly not as high as teenage girls, but that number is still up more than 8% since 2011. 30% of teenage girls seriously considered attempting to unalive themselves in the last year. That's up 60% since 2011. And instances of sexual violence for teenage girls were also up by almost 20%. More than half of the LGBTQ plus students had recently experienced poor mental health, and 45% had seriously considered attempting to unalive themselves within the last year. I'm sure you're wondering, where are these kids' parents? Well, according to 86% of the teenagers, their parents most of the time or always knew where they were going and who they were hanging out with. It's important to know the study doesn't specify why these alarming factors have been increasing dramatically over the last decade. But from other studies, we know social media in large doses does negatively impact teenagers in all of these categories. Now, there are some positives in this report. Risky sexual behavior and substance use has decreased over the last decade. The study also found there was a decrease in the proportion of young people who were bullied at school. So what helps? According to the study, school-based activities made a profound difference in the lives of teenagers. Things like making school environments safer and more supportive, with strong focuses on making teenagers feel connected to their peers and to their school, increasing access to services, especially when students are displaying troubling behavior, and providing quality health education so teens can understand their own mental and physical health. The CDC says since teenagers spend more than 95% of their daily lives at school, it's also important that schools play a major role in trying to solve these problems. If you want to read this report for yourself, I'll post it on my website, LisaRemillard.com.